when I was a new grad ICU nurse, I was in the HVICU myself. And one of the nights that I was on night shift, pretty freshly off orientation. I had only been a nurse for less than a year. I remember I had a patient who went into AFib with RVR, that's rapid ventricular response, for the first time, without having a preceptor with me, right?
Right.
So, for those of you who aren't familiar with that, disease process, atrial fibrillation is basically when the top of the heart is essentially quivering, that's fibrillating, and then the bottom of the heart sometimes responds and tries to match the atrial rate because most of those beats get conducted to the ventricle. So that's what RVR is. And so then that's a very fast heart rate, right? So too fast of a heart rate, you don't get enough of a cardiac filling time. You don't get enough blood out of the heart because the heart doesn't fill enough.
It all goes back to your cardiac output being stroke volume times heart rate, right? So if your stroke volume is smaller and your heart rate is higher, cardiac output is going to be lower, which is part of what's going on with AFib.
Anyway, yeah.